Hi, I'm Kim Steele-Peter, and I work for Tacoma-Pierce County Health Department. You've heard a lot about isolation and quarantine during the COVID-19 pandemic. Both are strategies to keep people who are sick or exposed to a disease away from well people, so we limit the spread of disease in our community. In this video, you will learn what isolation and quarantine are, why they are critical public health tools, and how they play a key role in disease investigation. Isolation and quarantine are two terms that are often used incorrectly. They are different concepts and serve different purposes. Isolation is separating someone who is sick with a disease from others. Quarantine is separating someone who has been exposed to a sick person and might become sick as a result. Isolation and quarantine are known as non-pharmaceutical interventions, or NPIs. NPIs are ways that we control the spread of disease without using medication. Other kinds of NPIs are washing your hands, covering your coughs and sneezes, cleaning frequently touched surfaces. When diseases of concern circulate rapidly in the community, such as COVID-19, stronger NPIs may be put in place by health officers or elected officials. Large gatherings, public places, and businesses may be required to close temporarily to protect public health. NPIs are important tools we use in public health when we have no medication, treatment, or vaccine for a disease. Without the ability to prevent disease, we need to be able to identify and stop it from spreading quickly. Isolation and quarantine are targeted interventions that we use on an individual case-by-case basis. These usually aren't applied to entire groups or communities. It involves identifying individuals with a disease that can be spread from person to person. We then ask these individuals to stay separate from others to stop the spread of the disease. When someone is sick and tests positive for a disease that can infect others, they need to go into isolation. Once a person is identified with a disease, they may be interviewed by a healthcare professional or a health department employee to identify their close contacts. Close contacts are people who were around someone while they were sick. Sometimes people are asymptomatic, meaning they don't feel or look sick, but they can pass the disease on to others. Close contacts can be asymptomatic for several days before they develop symptoms. Quarantine keeps these people home so they don't spread disease without knowing it. Disease investigation work, isolation, and quarantine are some of the oldest and surest public health tools we can use to keep our community healthy. Disease investigation work is complex, but it is one way that Tacoma-Pierce County Health Department protects and improves the health of all people and places in Pierce County.